Hi, my name is Catherine Martin, and I'm with the University of Alberta Faculty of Nursing, and today we're going to demonstrate a sterile dressing change. After checking the doctor's orders, you need to gather your supplies. The supplies you will need to gather are a sterile dressing tray, your bandages, some tape, normal saline, and 2 pair of non-sterile gloves. Prior to starting your dressing change, you need to check if your patient needs to go to the washroom or if they require an analgesic. The next thing you want to do is remove your rings, watches, and any jewelry, and then wash your hands. Okay, now we will begin to prepare our sterile field. When preparing your sterile field, you want to remember the principles of surgical asepsis. I want to have my table waist high. Anything below my waist is considered contaminated. And I want to make sure my table is positioned so that I'm not turning my back on my sterile field and I can work on the patient's sterile dressing and my tray. For a complete list of all the principles, please watch the video on principles of surgical asepsis. This dressing change is considered to be a no-touch technique, which means you do not require sterile gloves at any point during this procedure. You will wear your non-sterile gloves for removing the old dressing on the patient because at that point you are coming into contact with blood or body fluids. For the purposes of setting up my tray, I will wear the non-sterile gloves, but that is not necessary. Now we're going to set up our sterile tray. You want to get your sterile dressing tray and read the label on the outside to see what's inside of that tray so that you know if you have to gather any extra bandages or supplies. Some sterile trays have information on the outside and some have a package insert. All sterile dressing trays come with a perforated edge, and what you do is just tear that off to open your tray. Once you remove your sterile tray from the plastic, you want to gather the little piece on the outside, and the first opening is away from you. Remember to just touch the very outside of your sterile drape, and the 1 inch on the outside is considered contaminated. Some trays have a pair of forceps that you can use, and then once you open your complete drape, you want to square your tray so that you have maximum room. Now, for purposes of demonstration, we have replaced our sterile drape with a marking that shows the 1 inch around the outside that's considered contaminated. Inside my sterile tray, I have a sterile drape that I will use with the patient in order to extend the clean field. So I will lift it off the tray, step back, and drop. Keeping my forceps pointed down, I have a garbage bag. Again, when I remove anything from my sterile field, I will lift it, step back so that I'm not waving over top of my sterile field, and drop. Inside this sterile tray, I have forceps, some 2x2s for cleaning that I'll remove, and some 4x4s. Now, when I put my forceps down, I want to make sure that the part where my hand has touched is sitting on the 1 inch on the outside of my drape. I want to open up my garbage, making sure that I'm not flipping it or flinging it around so that I'm not breaking the principles of sterile asepsis. And with a couple of pieces of tape, just attach it to the outside of my table. Now we're going to add our normal saline to the tray. And remembering the principles of surgical asepsis, when you take the cap off, you want to put it on upside down so that you don't contaminate it. And when you want to pour anything or add it to your sterile tray, you always want to pour away from the writing. And some people suggest that you can lip your fluid first, which just means you spill a little bit into the garbage. And the idea behind that is it's to clean the top. There is not literature demonstrating that that's making any difference, but certainly something that you could do. Carry over your fluid, not to be too close to your tray because you want to avoid any spillage on the tray which will cause contamination, and then step back and away. Now we want to start to add bandages to our tray. And there is a couple of ways that you can add your bandages, ensuring that they remain sterile. All sterile bandages have an opening at the top, and this is the part where you can put your fingers without contaminating the bandage. One of the ways to add to our tray is to turn it upside down, just keeping your fingers at the opening, very gently tear it apart over top of your tray, keeping the sterile inside of the package facing your sterile field. Remove it back, step away, and discard. Once again, you want to open up your package with your fingers only touching the part that was not sealed. Upside down, over top of your tray, very gently drop onto your tray, keeping the inside part of the package that is considered sterile facing your sterile field. Step back, remove, and discard. The other method of adding bandages to a sterile field is to use your forceps. So once again, putting your fingers just on the part that has not been sealed, peel back, grab your forceps, reaching inside, drop your bandage, and step back. Again, open your package, only touching the part of the package that was not sealed. And as you peel back, be very careful just to touch that part. Grabbing your forceps, you can remove the bandage from the packaging, drop onto your field, and step back and discard. The last bandage to add is the abdominal pad, and we're not going to add it to our tray right now. At the end of the dressing, I will show you how to open it up, place it on your patient, and keep the inside of the bandage sterile. I want to open my sterile drape that is now considered a clean drape, and the purpose of this is to extend the clean field or the clean area for you to work on. One side of the drape has a slight plastic to it, and that's the part that's down on the bed. So I just want to lay that around to extend my clean field. I now need to remove the patient's dressing. So I loosen the tapes and just very gently remove the bandage, taking time to observe the drainage on the bandage for the amount, the color, and if there's any odor. I will document this drainage. I then want to dispose of it in my garbage. What I have observed here is there are still some drain sponges on, and I'm going to use my forceps to remove these. Once again, the same thing, observing the drainage for odor, color, and amount. At this point, I'm finished using these forceps, and I will dispose of them along with my gloves and put a fresh set of non-sterile gloves on at this point. It's important to take a moment and observe your patient's incision and drainage. In this case, I note that my patient has an incision with the edges well approximated, put closely together. I note that there's sutures in situ or in place. And the patient also has a stab wound with a Penrose drain pinned to the side. You want to observe the color, any drainage, the condition of the skin around the incision, and if there's any odor. The next step is I want to clean the incision, following the principles of clean to dirty, top to bottom. So in order to moisten the 2x2s, I just put them in the normal saline, and then I need to wring it out so that it's not dripping. And then I can just fold the corners into the center. Following the principles of surgical asepsis, keeping tips down. The first wipe is from the top. One wipe, one way, and discard. And then I get a second 2x2 and repeat the procedure. and I'll wipe down one side, top to bottom, one wipe, one way, and discard. Again, now the other side. Top to bottom, one wipe, one way, and discard. The next area I need to clean is around the Penrose drain. My forceps can touch the Penrose drain because it remains sterile to the patient. So again, when I put down my 2x2, I wipe, keeping my 2x2 right on the skin, one wipe around, one wipe, and discard. You can also repeat this procedure going a little bit further out if the skin needs cleaning. This is based on the amount of drainage coming from the Penrose drain. Again, one wipe, one way, and discard. Now we're going to dry. Again, the procedure is the same. You take your 2x2 and you can either fold in the corners if you wish. Again, following the principles, you clean down the incision first, top to bottom, one wipe, one way, and discard. And then you're going to dry down one side and then the other. Doesn't matter which side, as long as you continue to follow the principle. If you need to repeat that, you can repeat that as many times as possible or as necessary, as long as you follow the principle of the one wipe, one way, and discard. To clean around the Penrose drain, again, clean to dirty, so as close to the incision as possible. One wipe around and discard. And if necessary to dry, you can go out a little bit further on your second wipe to ensure the skin is dry. Be sure that while you're doing this dressing, you're keeping an eye on your patient, communicating with your patient, making sure they're remaining comfortable, and answering any questions they may have. Now what we want to do is start to apply our bandages. First bandages we're going to apply is our drain sponge. This is our pre-cut sponge that goes around the Penrose drain. And one of the ways to put this on is one sponge facing downward and a second sponge facing the other way. In this case, our incision is actually covered and there isn't much drainage, but you certainly can add an extra 4x4 or bandage covering and just judge it based on the amount of drainage that you're anticipating from your patient's wound. At this point, the last bandage I need to add is my abdominal bandage. If you recall, I did not add it to my tray earlier. All I have to do when I add this bandage is be sure I'm touching only the outside part. The outside part is clearly delineated by a blue line, indicating that that's the part on the outside. Keeping my fingers just along the blue line, I open it up and simply set it on top of the patient's wound gently, and then I can secure it with a window tape dressing. And this concludes the sterile dressing change.